yesterday we executed a budget agreement that we are very proud of because it saved the Hennepin County Medical Center devoting $705 million to ensuring that that important statewide asset continues to be able to deliver the life-saving and irreplaceable care that it does. Thousands of Minnesotans all across the state rely on HCMC. I always say in the worst day of your life, you're very likely to end up at HCMC, and we want to make sure that that hospital is viable and sustainable in the long-term future, and we took a very important step in that process yesterday. We are dedicated to ensuring that HCMC remains a vibrant and viable institution in the long run. We're also thrilled with the $1.2 billion bonding bill that we have agreed to do, which will make critical investments in infrastructure all across the state of Minnesota, creating jobs at a time when our economy is starting to take a turn for the worse. We were happy to take steps to address property tax increases and to provide the tab fee deal as well, and a host of other very important provisions. You know, this was a team effort, and I have a great team to work with here. I want to make a major thank you to our Ways and Means Chair, Cedric Frazier, who was just a tireless advocate during this budget deal for the things that were very important to our caucus. I also want to thank our tax chair, Representative Gomez, for her work on this, and in particular, Representative Agbaje, who has just been a fearless champion for HCMC and a primary driver of that piece of legislation. In fact, I'd like to turn it over to Representative Agbaje now.
Thank you all for being here. My name is Esther Agbaje. I represent House District 59B, which covers the parts of downtown and North Minneapolis. Again, this is a big day for HCMC and making sure that the hospital is around for years to come. I'm very glad of the work of our leader, Stevenson, to make sure that the hospital was front and center during the budget negotiations. We knew that this is very important to our public safety net hospital and all of our hospital systems. And without HCMC, everything else would probably start to crumble. And so with this funding that we have, we know that we can help retain staff. We can make sure that workers know that this is a safe place to be at, and patients know that they can continue to receive high quality care from here. All of you probably has an HCMC story, and I imagine that you will continue to have stories from this hospital for years to come. So with that, I think we can open for questions.
Can you explain what the property tax relief element is?
Do you want to talk about that? So there's $125 million in this upcoming fiscal year for a homestead tax refund. So this will accelerate the money getting out the door to help people with the rising property taxes.
But is it, what is it? I mean, who gets it? Yeah.
Thank you. So it is for property taxes due. It's for this year. It's for property taxes due in '26. It is a 12% increase in the homestead credit. And so those payments that a lot of us have already maybe applied for when we filed our income taxes, they don't go out until later in the summer, after the fiscal year. And so those homestead credits will be increased by 12%.
Across the board? For everybody?
For those who receive the homestead credit, yes.
In terms of the, were you going to continue to answer? I apologize. In terms of the HCMC funding, how much of that money is specifically for HCMC and how much of it, if any, is for other hospitals and health systems? And then what's the criteria to qualify for that?
So it's two pieces. First, there's $205 million that comes out right away specifically and exclusively for HCMC. There is a $500 million budget reserve that becomes available next summer, and that has an eligibility criteria that's pretty specific, and I'll let Representative Agbaje speak to that.
Yes, so the criteria for the reserve funding is based on the amount of medical assistance that each hospital provides, the amount of uncompensated care fund, and the amount of that's related to their budget. And so we have that detailed out. I think as the language comes out, we can talk more about it. But the idea is to make sure it's hospitals that are doing that type of services, and that those would be the ones that would be eligible for that reserve fund.
Yeah, so a couple other things. One, the fund is only available to hospitals that are on the brink of collapse and meet that criteria. So it's a pretty narrow strike zone that HCMC clearly fits within. And so that's why we say it's available to HCMC. I don't know that there's any other hospital right now that would meet the specific criteria that would trigger the fund. You know, due to the disastrous policies of the Trump administration, HR 1 and everything that's happening with Medicaid, we might be in a different world a year from now. I'm imagining we're going to be dealing with the fallout from the Medicaid cuts and the punishing aspects on hospitals around the state of Minnesota for years to come. But it does have a pretty narrow strike zone to be in the bill. We also, in this budget agreement, did secure a $30 million uncompensated care fund that hospitals around the state can access. That is in addition to the $705 million that we keep talking about. So you have the $705 million, then this $30 million uncompensated care fund. Lastly, we did increase Medicaid rates for critical access hospitals, and that is not an HCMC thing, that's rural hospitals, so they will get some relief as well. So there's a fair amount in here for hospitals.
Can any of you address the future of the ballpark tax? I know at one point it was gonna become a healthcare tax, and now it sounds like it's gonna be sunsetted unless some changes are made. What is the future of that?
There's no change in the existing law around the ballpark tax, so that tax sunsets once the bonds for Target Field are paid off.
And when is that, what year is that anticipated to be?
So the reason that the ballpark tax has been an issue in the last couple of years is because it's collecting more revenue than was anticipated when the deal was first conceived of. And so there is the opportunity to pay off the bonds early, which is why this conversation's been happening. My understanding is that the earliest they could be paid off is in December. That's when the next bond sale is. The other factor with the 0.15 sales tax is that there are other obligations besides the ballpark bonds that come out of that. There is funding for extended library hours, youth activities, the functioning of the ballpark authority, and some money for capital. And those obligations continue. I'm not exactly sure when. I think it's in the 2030s. So, but basically, we have another 10 years of those obligations to meet. And so the earliest possible time that the 0.15 would actually blink off would be after there was sufficient revenue collected to meet those obligations over the term of the current kind of statutory obligations to those other functions, if that makes sense.
So that could go beyond when the stadium bonds are paid off.
Right, I mean, they would have to, the county has to account for that ongoing, I mean, it's around $7 or $8 million a year, basically, over the next 10 years, give or take. If anybody needs detail, I can get it for you. But basically, like, they would have to collect another couple years of the 0.15 in order to have enough revenue to meet those obligations over the longer term.
It sounds like that money could be put in a reserve to pay that off in future years, even though the tax itself could blink off once enough money's collected.
That's my understanding from the county, yes.
And importantly, that's all existing law. We didn't make any changes to the law governing that tax.
The school safety deal, could somebody speak to if the office is happy with where you landed on that, and also clarification if that's for private and public schools?
Well, you know, we have been advocating all session for comprehensive gun violence prevention, including an assault weapons ban and a high-capacity magazine ban. That is the work that Minnesotans expect us to do to address this issue, and we are incredibly frustrated that Republicans won't even let us have an up or down vote on the House floor. There are 4 days left in this session, and we will fight for a floor vote every single day of session. We will fight because it's kind of crazy that bill can't even get out of the speaker's desk at this point. We need to have a vote on this. That's what Minnesotans expect. There is funding in the budget agreement for mental health at schools. There's $12.5 million for school-length mental behavioral health grants. There's $3.8 million for mobile crisis grants. I think there's one more piece of that. Let me find that. The anonymous threat reporting, $5 million, thank you, $5 million through the Department of Public Safety and a grant program there. So the first two things that I mentioned are existing grant programs where we just added additional funding. For anonymous threat reporting, schools will be required to have an anonymous threat reporting system, and the grant money will be available through the Department of Public Safety to develop that, and it will be available to both public and private schools.
Stevenson, the NLX funding is on the line as part of this HCMC deal. I know there's a big priority for Leader Horton. How are you feeling about that specifically?
I think there's been a lot of miscommunication about this. This actually does not change anything about the NLX appropriation except for where the money would go if the project cancels. So under existing law, the NLX appropriation that was made in 2023, if unspent, cancels at the end of fiscal year 27, okay? Fiscal year 28. So it would cancel to the general fund if it is unspent by that time. The only change is that if the project cancels on that timeline, it will cancel instead to this hospital reserve account. So the project can continue. You know, we heard all last year that this project would never happen, that the federal government was about to cancel it. You know, it was a fiction, and then actually over the course of the interim, it actually moved forward in the federal approval process. That project is still very much alive, it's still very viable, and this agreement doesn't change anything about that. It's just that if the project doesn't happen, instead of going to the general fund, the money will go to this reserve. The same thing is true about the $30 million that was appropriated for the Blue Line. There's no change in the timeline there, and that project can continue to move forward. It's only if the project doesn't move forward would the money go into the reserve fund.
About the property tax, with the homestead tax, will homeowners, taxpayers have to apply for that, or will it automatically be applied?
So I believe they sort of will apply through the normal process. Those who qualify for it will just receive a 12% boost, so there's no additional application for that.
Broadly, these negotiations take a lot of give and take usually. We've heard a lot about some of these measures that you guys are pleased with. What were some of the gives that Republicans got as part of this that were in those negotiations?
Well, I would say principally we are very frustrated that we didn't get comprehensive gun violence prevention. That's what Minnesotans expected from this session. Over 70% of Minnesotans want to see a assault weapons ban, a high-capacity magazine ban. These are uncontroversial provisions that would save lives, and that Republicans are refusing to even allow an up or down vote on the House floor, and that remains a source of continuing frustration for us. In addition, Republicans were unwilling to address the disastrous consequences of Operation Metro Surge, whether it's reining in the abuses of ICE agents or trying to help the businesses that were impacted by that disastrous operation. So we are very frustrated that those two elements were not included in the budget deal, but you know, we will continue to fight for them in the remaining days of session.
Were those discussed in negotiations for this deal? This
Absolutely, absolutely.
Can you clarify, like, the $40 million in rental assistance is not a part of this deal?
It is a part of the deal, yeah, and it is actually already passed, yeah.
The $75 million in IT funding, we've talked a lot about Oregon Trail IT systems throughout the session. Is that enough money for this, and how will that money be used?
There's ongoing money as well, as you saw. There's $15 million ongoing, and there's actually also a provision that would take up to $50 million if there's a surplus at the end of a budget year. Up to $50 million would go into future IT spending, because we know that this is, you know, going to be an ongoing process, and that just $75 million one time isn't sufficient to meet the ongoing technology infrastructure needs of the state. So there's some ongoing funding here, and then a way to scoop in even more should we have budget surpluses in future years. But I think that this is a historic step forward on IT for counties, which number one is going to allow you know, workers all across the state to deliver these services more effectively and more completely to the people who rely on them. It will move us out of the Oregon Trail era and the green screen era of technology for state workers. It's a big step forward that we are really excited about.
Is it money counties can spend as they please, or how do you?
No, the money will all flow through Minute. I think there's a variety of different ways it's being distributed, but it's all flowing through Minute.
Can you talk about how the $1.2 billion in bonding was settled on?
So Minnesota has, a couple things limit the size of the bonding bill. Number one, we have, debt capacity guidelines that we follow very carefully. And of course, we now have to pay for bonding bill debt service. It used to be baked into the forecast, and now we have to account for it. So budget reality shaped the maximum size of the bonding bill. 1.2 was what we could finance this year in a responsible fashion. One thing that Minnesotans should be really proud of is that we are a very fiscally responsible state. We have a number of budgeting practices that other states don't have, and that's one of the reasons why we are one of a very few states that have a perfect bond rating from the credit houses. And this agreement continues in that tradition. One of the things that hasn't been discussed much here is that this agreement actually reduces that structural deficit that we have projected by over 10%. The fact that we were able to accomplish that in a non-budget year while still making these other investments that are so important is an incredible accomplishment that I'm very proud of.
Is there anything you all are looking at to, obviously you're celebrating having this funding for HCMC right now, but is there anything you all are looking at to make sure that we don't end up in this exact same spot a couple years down the road?
Yeah, absolutely. So number one, as part of the agreement that Representative Agbaje put together, there will be a task force working through the interim to develop a permanent and long-term solution for HCMC. But as I mentioned a minute ago, due to the absolutely catastrophic policies of the Trump administration, most particularly the cuts to the Medicaid program, hospitals around the state are really going to be struggling for years to come. In some ways, HCMC is the canary in the coal mine because they are uniquely exposed to the Trump administration's policy given the people that they serve. But every hospital serves people who rely on Medicaid, and Medicaid is an important part of every hospital's financing. So as those cuts come into place, hospitals around the state will be subject to the same pressures that HCMC is feeling right now. That's why the task force that Representative Agbaje put together is going to be so critical to our work next session. I would expect that healthcare and hospitals will be a major topic of the 2027 session.
Speaker Demuth was pushing for state conformity with the federal no tax on tips and overtime. It looks like this did not make this agreement, and if that's the case, why didn't it?
Couldn't afford it.
Did she push for it in negotiations, or?
We'll leave the negotiations to themselves, and she can speak for what she pushed for.
And it's bad tax policy.
I'm sorry for the off topic, but can you comment on the Hennepin County lawsuit and your text to the Hennepin County mayor?
Anoka County's
Anoka.
lawsuit. It was a joke that was taken out of context in a filing. I'm sure everyone in the room has sent a joke to a friend that they would not really want published in a newspaper article. I'm not going to apologize for fighting for my district, and it's an ongoing legal matter. I'm not a party to it. I'm not going to comment much further on it.
Another question about HCMC. Wondering what current independent oversight exists in terms of any public dollars spent by HCMC, and with this additional money, will there be any additional oversight baked into that legislation?
There absolutely will be, and again, I'm going to refer to the great work that Representative Agbaje did, because another piece that was negotiated in this was a new governance structure for the hospital, because we all agree that we need to make sure these dollars are spent to ensure that the hospital remains serving the patients and that the hospital is viable in the long run. So I'll let Representative Agbaje speak to the governance deal.
Yeah, in the governance pieces of it, we ensured that the county board moves to a professional board to oversee the hospital, and that professional board will have folks on it that have the requisite requirements of finance, public health backgrounds, administrative backgrounds to be able to run a hospital. We also have people on there, we also are requiring that they'll have people on there who also have that community and urban center experience as well. There will also be more of a kind of a two-step process before a dissolution or a takeover of that board can happen. So there's a forced mediation between Hennepin County and the hospital board, particularly if there are major issues of financial distress. And finally, there will be continued reporting requirements for these public dollars that they're seeing. Again, this is really just to ensure that because of the state intervention, that we all have a stake in making sure that HCMC survives through the long haul.
Will this professional board be different from the one that was dissolved in 2025?
It won't, in terms of number, it probably won't be that different, but in terms of makeup and kind of the skills behind it, we hope to see that it's more different in terms of people who actually understand how to run a hospital.
Can you confirm where this money's coming from, the 205 and the 500 million, what funds and pools those are coming from?
So as Leader Stevenson said before, that's coming from the general fund, from the $205 million to pay upfront, and then the $500 million is a reserve fund from the budget reserves.
Medicaid funding, CMS funding is sort of hanging over the state right now. Do you have any concerns that you're out over your skis on any of these outlays and that, you know, this money might never come through from the feds and the state could be in a bad position?
No, actually, I think that this is actually a very responsible budget. As I mentioned, we actually decreased the structural deficit by over 10%. We make sure that there's a surplus both at the end of the current biennium and the next biennium. Obviously, the federal government is seeking retribution from the state of Minnesota, in President's own words, and so it is a major concern as we look at the budget, and one of the reasons why we were careful in putting this budget together and focusing on the things that were absolute priorities, like ensuring that HCMC remains viable for the long-term future. You know, we did not engage in unnecessary spending in this budget agreement.
Could you talk about?
Just real quick on that. Also think it's important to note that when we were debating the Medicaid requirements that the federal government has put on this, you heard Republicans actually cheerleading it, right? They are in favor of these requirements, which are going to kick people off of Medicaid, and yet they're not connecting that to the very point that we're hearing about this impact on hospitals over the long run with the increase to uncompensated care. So it's not just the federal government that is wanting to see these Medicaid requirements for increased paperwork and kicking people off that are going to harm Minnesotans.
Could you talk about all the changes in one big beautiful bill affecting Medicaid and supplemental nutrition assistance, the work requirements, re-eligibility? How does the budget agreement tackle one big beautiful bill changes in Medicaid and supplemental nutrition assistance?
You know, we do come into alignment with federal requirements. If we had failed to do that, we would have been subject to billions of dollars in penalties, but we did try to soften the blow as much as possible. So for instance, under President Trump's bill, coverage when you sign up for Medicaid, well, let me back up. Under existing Minnesota law, when you sign up for Medicaid, you get retroactive coverage for the 3 months right before you sign up, which is a really critical benefit for people who have a medical emergency that drives them into the hospital that they need care for and then subsequently sign up for Medicaid. Under President Trump's approach, that is shortened to between 1 and 2 months depending upon your eligibility. In this budget agreement, we will preserve that 3-month retroactivity for the next fiscal year, which allows us an opportunity next year to look for a long-term way to protect those Minnesotans. And there are other examples that are similar to that. And when we look at trying to ensure that the SNAP program, for example, is as functional as possible for people, despite the federal attempts to sabotage that program. We did invest substantial resources into our SNAP program in order to try and preserve it for the long run. We also have a $10 million appropriation in this budget agreement for food banks and food shelves that should help people who are struggling due to the attack on the SNAP program.
Can you talk a little bit about the memorial components of the deal?
Yeah, you know, obviously, this was a very important thing for our caucus. Speaker Hortman was the most consequential speaker in Minnesota's history and deserves to be remembered as such. And also, I think it's important that we have these memorials around the state so that future generations can learn from what happened here, and hopefully we don't have a repeat ever again of the kind of political violence that we experienced this last summer. So there are 4 memorials that are part of this deal. One is a $200,000 appropriation to Helping Paws, the service dog organization. Another is that Highway 610 between, for its entirety, I saw covered somewhere that was a portion of it. It's actually the entirety of Highway 610 will be renamed the Hortman Memorial Highway. There will be a memorial garden on the south side of the state office building. And the 4th is there will be a work group to develop a state park proposal for the Capitol complex. This was something that Speaker Hortman really believed strongly in, that the state Capitol complex should be more accessible to the public, that when folks come here, they should be able to understand the history and be able to navigate the place more clearly. And she was a big fan of our state park system, thought that they did a really great job of doing that, and wanted to take a similar approach here on the Capitol grounds. And so over the next interim, there will be a work group trying to develop that proposal, and then we'll hopefully create a state park here on the Capitol grounds next session.
A statue in that park, if I can follow up a couple of, a statue had been talked about, is that?
In the memorial garden that I mentioned on the south side of the state office building, there will likely be a statue component. That won't be like in the it won't be so prescriptive in the legislation, but the contemplation there is for a statute as part of that.
And the new building will not be named after her then?
Not as part of this package, no.
You're nearly at the end of your first session as the leader of the caucus. How was it? Did you enjoy it?
Well, this job has its ups and downs. The best thing about this job is the people I work with. We have an incredible caucus full of really talented leaders, and you've gotten to hear about the amazing work that my colleagues have done. It is just an incredible privilege to get to speak on behalf of this caucus, to represent their interests in these negotiations. But the only reason why we're able to talk about these great things that we got done is because the people standing behind me and the other people who are members of my caucus brought those ideas forward, did the hard work that is often unrecognized to develop those ideas. And then I had the privilege of advocating for them at the leadership table. And now we get to stand before you and make Minnesotans' lives better. It's hard to beat that.
Can you talk about the last few days of session and the trajectory for getting all of this done?
I think it's going to be an intense 4 days. I think there's a lot to do. I'm really pleased that there's an agreement among all 4 caucus leaders for an orderly end to session. That is a key component of the deal from my perspective, because I think that that's what Minnesotans expect, that we do our work, that we do it thoughtfully and responsibly, but we do it in an orderly fashion. So it's going to be some long days here for the next few days, but I'm really hopeful that we'll get our work done.
Thanks, everyone.
Thank you.
Thank you so much.